My name is Andrés Villaveces. I have been working in the area of injuries and violence prevention for about 30 years. And I have worked on many topics around injuries and violence prevention. Right now, as you mentioned, I'm a senior scientist at the US Centers for Disease Control. I work on the Division of Violence Prevention, and most of the work that I do right now is on the prevention of violence against children. And we do work globally. Most of my tasks are to work in several countries, including the United States, of course. Previously, or I started my career as a physician and then trained as a public health practitioner, and later on got a doctorate degree in epidemiology at the University of Washington in the US. I worked for the WHO, the World Health Organization in Geneva, at the Unit of Violence Prevention there, and did a variety of activities on firearms or on capacity building on injuries and violence prevention. I have worked in quality of care at the University of Geneva in Switzerland. And then I worked as faculty, as professor in the Department of Epidemiology at the University of North Carolina in the United States. I've also worked at the RAND Corporation, a private organization, and most of my work there was in transportation safety. And then I transitioned to work at the World Bank. At the World Bank, I worked on youth violence, and then after the World Bank at CDC. So long career in many places, but spanning multiple areas of injuries, transportation safety, violence prevention, burn-related injuries, fall-related injuries, occupational injuries, all those topics I have dealt with at some point in my life.